What are the main side effects of a transplant? How are those side effects managed?
So the main side effects of transplant are hair loss, which typically happens about 2 weeks after the melphalan is administered. Cold caps can prevent hair loss. The principle really is the same as when we ask people to chew ice during the melphalan infusion. When you make a tissue cold, you constrict the blood vessels, and the delivery of chemotherapy to the hair follicles is limited. However, this is still an area of active research. There has been FDA approvals for cold caps for patients with breast cancer, but in myeloma, the skull is an area where there's lots of marrow, so it needs further study to make sure it doesn't decrease the efficacy of the therapy before it's rolled out in full. So I am not aware of an FDA approval for cold caps in myeloma for auto transplants as of yet. The main other toxicity of melphalan is it damages the intestine. So diarrhea, nausea, decreased appetite. Those are the main complications. There's also mucositis, which is inflammation of the mouth. Now, that is typically managed by eating ice chips while the melphalan is being infused. That makes the mouth very cold. It decreases the delivery of melphalan to the oral tissues and protects the mouth from developing sores. But there's no way of doing that for the rest of the intestine, so people do have those side effects. Most of the time, it's very mild. Patients don't want to eat very much. So their appetite drops considerably, but they can be supported with IV fluids. The diarrhea can be managed with anti-motility agents like Imodium or Lomotil. Sometimes we have to give some stronger drugs, but most people can manage with that where they're going maybe once to twice a day. And the IV fluids helps them get through the rest of the procedure and the side effects.
How can patients deal with nausea during transplant?
We have great medications for that. Oftentimes we just ask them to take some Compazine or Zofran or sometimes something called Ativan, which they anticipate anxiety when they look at food. So that can calm them down, and we can just schedule that around the clock in patients who are having a lot of trouble. IV fluids help. Sometimes low-dose steroids can also be very helpful in calming those issues. So most patients we can get through the transplant procedure without them feeling too bad.